Ultrasound reporting of epididymitis. This often affects men in their reproductive ages, especially men below the age of 35. So what is epididymitis? Epididymitis is the inflammation of the epididymis, which is the tube that carries sperm from the testicle. It is often caused by retrograde passage of urine from the prostatic urethra to the epididymis via the ejaculatory ducts and vas deferens. The symptoms can include pain and swelling in the testicles as well as fever, chills, and a burning sensation when urinating. The most common causes of epididymitis are sexually transmitted infections, but it can also be caused by urinary tract infections, injury, or other conditions. The physical findings associated with epididymitis include severe unilateral testicular pain, scrotal swelling, vomiting or nausea, loss of cremasteric reflex. Loss of cremasteric reflex will be described in details. Epididymitis has same physical findings with testicular torsion, but different managements. Epididymitis can easily be managed with antibiotics, especially when it is associated with sexually transmitted diseases, chlamydia or gonorrhea. Analgesics and non-steroidal anti-inflammatory drugs can be used to support the treatment. But in case of testicular torsion, it is a urological surgical emergency. Testicular torsion is a twisting of the testicle along its supportive tissue or the twisting of the spermatic cord. And the spermatic cord contains the cremasteric artery and the testicular artery, which supplies the testicle. So when twisted, the supply to the testicle will be compromised and the testicle might be lost if it takes time to diagnose it. So it is usually necessary to differentiate epididymitis from testicular torsion. However, color Doppler ultrasound is the gold standard in differentiating the two. Cremasteric reflex. When we gently stroke the proximal and medial part of the thigh, the scrotum of the stroked part moves upward gently, retracting the testicle, moves from D to C. This is not seen in patients with epididymitis or testicular torsion. When we stroke the medial part of the thigh of a patient with testicular torsion, the scrotum does not move upward. So what is the difference between the physical findings of epididymitis and testicular torsion, since the management is different and there is need to differentiate the two? The difference is Pren's sign. So what is the Pren's sign? It is the alleviation of scrotal pain with the elevation of the testicle. When we elevate the testicle of someone with epididymitis, the pain reduces. But in case of testicular torsion, the pain remains the same. It does not reduce. And we can also see elevated white blood cells in a patient with epididymitis, but that is not used in the diagnosis. We are going to look at the sonographic features of epididymitis. Epididymitis, being the most common cause of scrotal pain, has the following sonographic features. It is usually enlarged in size with hypoechoic, hyperechoic, or heterogeneous echo texture. There will be presence of reactive hydrocells. The scrotal walls will be very thickened, and on color Doppler interrogation, there will be increase in the vascularity of the inflamed epididymis when compared to the contralateral one. Epididymitis can be complicated with abscess formation, pyocells, which are complicated hydrocells with locules, with loculations, and segmental infarction. On pulsed wave Doppler, epididymitis will give a high peak systolic velocity above 15 cm per second, as we can see on the screen. The pulse wave Doppler interrogation of the inflamed epididymis shows a peak systolic velocity of 17 cm per second, which is highly indicative of inflamed epididymis. Thank you so much for watching. Please subscribe to our channel to support what we are doing. Hit the notification button so that you will know when we upload the next video.